Good afternoon, everyone. Welcome to the next installment in our Lifestyle Medicine webinar series. The Lifestyle Medicine program at the Mass General Cancer Center is hosting the 6-part webinar series, Exploring Strategies to Improve Health and Well-Being. We are thrilled that you have joined us today. Some of you may ask, what is Lifestyle Medicine? The Lifestyle Medicine program is available to all Mass General Cancer Center patients. Our program provides evidence-based lifestyle interventions that can improve quality of life, alleviate symptoms post-treatment, and also promote the adoption of healthy lifestyle behaviors after a cancer diagnosis. Our program provides personalized consultations as well as group visits for patients who want to have these recommendations. We are so excited about today's webinar, and I should note that at the conclusion, there will be an opportunity for a Q&A, so you can type your questions in the chat box. This is also being recorded, so we'll share it on our Lifestyle Medicine YouTube site in the next few days. The title of today's webinar is Road to Resilience, Lifestyle Medicine Tools Paving the Way for Anxiety Relief in Cancer. And we have two amazing speakers that I'm so privileged to introduce. Dr. April Hirschberg is board certified in both adult psychiatry and lifestyle medicine. She completed her residency in adult psychiatry at the MGH McLean Combined Psychiatry Program in 2006. And since then, she has remained on the staff at the MGH Department of Psychiatry, first in the Center for Women's Mental Health and later in the MGH Cancer Center. She's also certified as a health and well-being coach, and she is certified to deliver the Stress Management and Resiliency Training Program and the Resilient Youth Training Program by the Benson Henry Institute for Mind-Body Medicine at MGH. She has been offering Mind-Body Smart programs for cancer survivors since 2017, and more recently for individuals at increased risk for cancer. Last fall, she co-led a Paving the Path to Wellness virtual lifestyle medicine-based group program at MGH. She's a faculty advisor for the American College of Lifestyle Medicine residency curriculum within the Department of Psychiatry at MGH. Currently, she offers resiliency groups for veterans, service members, and their families, and she is the medical co-director of the Mind Body Health at the Home-Based Program for Veterans and Family Members, a partnership of the Red Sox Foundation and MGH. Ugne, how do you pronounce your last name?
Aleknaite.
Sorry. Okay, we're so grateful to have her here. She's an oncology program leader at Nantucket College Hospital, where she manages care for cancer patients across the spectrum of cancer diagnoses and along the continuum of disease from diagnosis, survivorship, recurrence, and to end of life. She has completed board certification through the Institute of Functional Medicine. As a meditator for 20 years, she believes that health and well-being come from kindness and appreciation for our particular situation and for relaxation to let life be our medicine. She loves working with people collaboratively to find balance through nutrition, movement, and mindfulness. Now I will turn it over to both of you.
Thanks so much, Amy. What a kind introduction, and we really appreciate being here. I happen to be the first speaker, and so I'm sure Ugne would appreciate you as well. The part that I always get stressed with is the sharing of the screen, but bear with me as I do that, and then we will start our talk. Oops, that's not what I wanted to do. Sorry, hold on one second. Okay, this is what I wanted to do. So here we are at the beginning of the Road to Resilience in our talk. And I just wanted to appreciate being here and being with Ugne and being able to talk with you about this important topic today. And I'm so glad it's being taped because it is important that we get this message out to as many people as possible. I'll talk a little bit about, we already talked about us, but I'll talk a little bit about our agenda. I'm going to start off with a relaxation experience. It's a rest and relaxation, or I'm going to define it further, but we're going to start that off just because I think many of us probably have already had a busy day and it's nice to arrive here. And we're going to do an overview of distress and anxiety, as well as the stress and relaxation response. I'll talk a little bit more about the program at at Mass General, the Center for Mind Body Medicine as well. And we'll talk about the pillars, the 6 pillars of lifestyle medicine, and how each of those pillars really support one another and can promote resilience. And then at the end, we'll have the helpful resources that we've put together, as well as time for questions. So let's get started. And I love this picture. So I will just invite people, as people are arriving, perhaps even still, just to take, we're going to not even take a minute. And I know that Ugne has done meditating for a very long time, and I have not done meditating for as long a time. And it wasn't until I learned the science behind the relaxation response that I started this. So that's why we will tell you a little bit about that science to try to get more and more people on board to take time out of their day to elicit the relaxation response, which is one of our body's physiologic responses. And so I'll invite you all just to take literally a minute. We're going to take a minute to just breathe. I know that sounds funny, especially since we're all breathing all the time. But we're going to take this time to just take some conscious breaths. So if you happen to be in a place that you can, if you happen to be driving, it's still okay. You can breathe. I just don't want you to close your eyes. But if you're sitting someplace comfortably and you can uncross your arms and legs and you can close your eyes, I would invite you to do so. Just take a few deep breaths, breathing in, noting that you're breathing in, and breathing out, noting that you're breathing out, breathing in and breathing out, breathing in and breathing out. Just another couple of breaths, taking deep breaths. It's okay if you breathe in through your mouth or your nose or both. There's really no right way to breathe, but just take some deep breaths, breathing in and out. And one last one, in and out. So taking those deep breaths, those diaphragmatic breaths or belly breaths, there's all kinds of different names for it, but taking a deep breath and not doing a breath that's shallow, which we often do when we're stressed or distressed, is really so good for our health. And it actually can have health benefits throughout the day. It certainly helps us when we do it, but also it has some additive effects for when we are approaching sleep in the evening. If you've had an opportunity to take some deep breaths throughout the day, you're eliciting your physiologic response, your relaxation response, and helping yourself lower your levels of stress. Again, we're not taking away people's stress, but we're employing a strategy to manage stress and elicit the relaxation response. So I'm going to talk a little bit more about the health benefits of the diaphragmatic or the belly breathing. Just reminding you that you have a very large muscle called your diaphragm, and it's below your lungs. And by taking deep breaths, you are not only relaxing that muscle of your diaphragm, you're relaxing the muscles throughout your body, and you're enhancing your relaxation, and you're allowing more oxygenation, frankly, throughout your whole body. And that helps you to concentrate, and it helps you to be able to make decisions a little more easily, because that allows your whole body to be relaxed and be in a state that is that relaxation response, that physiologic response. And it's the opposing response to the stress response. So we'll talk about that shortly. But thank you for doing that with me. And it's a great way to just start off, frankly, any meeting. And we do that sometimes in meetings that I run and in meetings that I attend. So it's a great way to take a couple of breaths. So as people were joining, you might have heard Amy and Ugne and I kind of chit-chatting about how it's already mid-May, and that's hard to believe. But I wanted to just let people know, if you haven't heard, that May is actually Mental Health Awareness Month. That's why it's so great we're doing this this webinar now. And this has been an awareness month that's been around since 1949. And it is an attempt to raise the awareness about the mental health crisis, really, that we're in across the world and in the United States. And it's an attempt to help reduce some of the stigma associated with mental health conditions. And because we know, unfortunately, since the COVID-19 pandemic, the numbers of people suffering with mental health conditions are really, really high. And anxiety is the one we're going to be kind of focusing on today, but there are many mental health conditions, as you all know. And tomorrow happens to be Mental Health Action Day. And we'll talk a little bit more at the end of this webinar, how you might take action in your own life to enhance your own mental health. But I just wanted to call everyone's attention to this. And unfortunately, mental health conditions are very common. They account for, it's basically over 1 billion worldwide. Individuals struggle with a mental health or addiction. And in 2021 alone, it's been estimated over 50 million people in the United States struggle with a mental health condition. And that's close to like 1 in 5 individuals over the age of 18. So it's a serious issue that we're all facing, and hopefully by learning some of the tools today, we can help take action in our own life and maybe share a few of the things you learned today with others to help them. So again, trying to bring it back to our focus today is we're going to be talking about cancer-related distress. And as many of you on this call know, that this type of distress exists across a continuum. This is the definition, or a definition, of this cancer-related distress. And I just wanted to, again, call attention to the fact that it is across a continuum or a spectrum, and the cancer-related distress can range to, initial feelings of vulnerability and sadness and fears, related to that cancer diagnosis or finding out you're at high risk for cancer. And it can be something that's not easily, but, managed and not too interfering with your life. But there are times where cancer-related distress or other conditions like depression or anxiety do interfere with our ability to cope, and it can interfere with the ability to access treatment and access the necessary scans, any number of things. So we really want to be identifying cancer-related distress and working to combat it or provide tools to safely and effectively manage it. This is a slide. Most people, or many people, have heard of the National Comprehensive Cancer Network. That's the NCCN. So that organization has really been recognizing cancer-related distress as an important part of care and treatment for the past several years. And so that's why we're talking about it today. And as I mentioned, anxiety is one of the most common forms, but not the only form of cancer-related distress. And it can range, again, anxiety itself can be along a continuum. It can be situational. Some people have referred to this as like scanxiety, or sort of in anticipation of certain parts of cancer-related treatment. It can be worsened by the disease itself, or the treatment that is utilized to treat and target the cancer. Or many people have an underlying mental health condition or an anxiety condition that gets that existed pre-cancer, and that kind of flares up during the course of the cancer diagnosis and treatment. So this is the most common form. And we know, as I mentioned, that the distress can be quite significant, but it is treatable. And today we're going to be talking about some lifestyle related ways in which we have the power and the ability to help our own symptoms of anxiety or mental health conditions. But there are other forms of resources and treatment that we'll talk about at the end as well, here at the Cancer Center and at if you're zooming in from a different state, there, all cancer centers have access to some supportive treatment and what's called psychological treatment or even psychiatric treatment if the distress or anxiety is severe, because we really do want to be able to target these symptoms, this distress, this anxiety, because as we'll know, and as many of you already know, that if you're struggling with these symptoms, it can affect so much of your life. It can affect your ability to fall asleep and stay asleep at night. It affects the way you feel in the day, your fatigue, and it can even affect your pain experience. And unfortunately, there are studies that show that in individuals with a cancer diagnosis, your risk of distress or anxiety is almost half of the general population, and people who are going through treatment, approximately a third, will relate and report that their symptoms are what's called significant, or they're impacting their life and their treatment. And we know that if anxiety or distress or these mental health conditions go untreated, they can affect our outcomes and how we do in terms of our mortality and morbidity, meaning how we tolerate some of these treatments. So I just wanted to call attention to this, and I think that this is where my history in terms of being a psychiatrist is helpful, because many times we realize and recognize that how we feel emotionally or our mental health, we have to remember that mental health is health, but our mental or emotional health can lead to perhaps these negative automatic thoughts. I don't know if people have heard that term before, but it's what's called gnats or ants, these automatic negative thoughts, which are ants, or negative automatic thoughts, which are gnats. It's not really spelled correctly because it should be GNAT, but negative automatic thoughts come quickly and too quickly and too often to people who are struggling with mental health conditions. And that negative automatic thinking, which is often unfair and unbalanced and unkind to ourselves, lead us to do things that are viewed as air quote bad for you, meaning, you might skip meals, you might choose foods that aren't particularly healthy, but that feel good at the time, or you might choose substances like alcohol or other substances to alter your energy or to kind of take the edge off. So there are choices that we make that are impacted by our mental circle, like one leads to another and then leads to another. And that's why we want to make sure we are intervening. So I'm going to go to the next slide. And I want to go back to that I mentioned at the start. So this is where I was mentioning physiology, and that we have the ability to alter our nervous system. And this is a great slide. I didn't make it, Ugne did. But putting together this, it's a balance, right? Life is a balance. And just so you know, on the right-hand side where it says sympathetic nervous system, that is what's called our body's stress response. And that's a natural part of our body that gets activated when we have a stressful life event. Historically or chronologically, that, from a survival standpoint, that goes back from a long time ago. And you classically think of that as like if you're out in the savannah or somewhere and you come across a scary animal, your heart rate's going to go up, your blood pressure is going to go up, and the respiratory rate and the muscle tension, and that will prepare you for what's called fight, flight, or freeze. And so that is the classic stress response. On the right-hand side, the sympathetic nervous system. But this sympathetic nervous system can be activated throughout the day from minor stressors, and I'm using, again, air quote minor, because the multiple chronic stressors of daily life, like getting to school on time for your kids, or you're getting to work on time, going to a scan. So those are more on the sort of major stressors. We have major life events that are stressors, and those all activate this stress response. the good news is there is a counter to this stress response in our body. It's called the parasympathetic nervous system. And by engaging that parasympathetic nervous system, which is that rest and digest system, it's the part of our body that, or part of our nervous system rather, that lowers our adrenaline or cortisol levels, lowers our heart rate, lowers our blood pressure and breathing rate, and allows that muscle tension to lower, and then increases our memory and concentration. And when I'm teaching this in various classes, I talk about the fact that the sympathetic nervous system activates the older part of our brain, because this has been around for so long, that we don't have to think about our breathing. And, it's like, oh, I'm about to mount the fight or flight or the stress response. But unfortunately, we do have to think about the parasympathetic nervous system, that rest and digest. And that is when we activate the parasympathetic nervous system, we're activating what's called our prefrontal cortex. And that helps us have that enhanced memory and concentration, because we are having that rest and digestive opportunity. So that's why taking those deep breaths at the start of this hour was an opportunity for you to activate your parasympathetic nervous system. So this is all discovered by Dr. Herb Benson, not discovered. He defined it, I should say, as the relaxation response. This has been around for millennia. People have done meditation, yoga, things to activate their parasympathetic nervous system. But Dr. Herb Benson described the relaxation response with a book in the early 1970s. And I almost grabbed it from my office, but I left it in a different room, so I apologize. But basically, this is that scary animal that can be perceived as very stressful. And this is just a way in which to remind us that it's our perceptions of stress that really are important. Because if we perceive a situation as stressful, even if it may not be as stressful as we perceive it, it's still perceived as stressful, and our body mounts a stress response. But if I said the word cat to you, some people might think of this type of cat, but other people might think of this type of cat. So it's our perception of a situation. And the thing about stress and distress is that we have remembered events from our past, or we have anticipated events in our future, and those also can cause us distress. So I just wanted to point out here that a little bit of stress in our lives is important and necessary. And again, along a continuum, because stress gets us, up in the morning, it gets us out the door, it helps us prepare for tests. But too much stress would cause us maybe to stay in bed or to not study for a test. So we want to try to find a balance. And when stressors really mount up and mount up and mount up, we need to have extra tools. And these lifestyle medicine tools are really great and can be employed throughout. So I'm talking too much, but I just wanted to say, we have some self-care strategies that we're already using. So I want you to, be happy that you have some, and you can think of some that might be helpful for you. And we're going to teach you some more today. So lifestyle medicine helps us do that. And as Amy mentioned, it's a great field that's been evolving and is divided into pillars. We're going to divide up the pillars and talk with you about them. And I've sort of set the stage for the stress management. And so I'll continue to talk about that. And as Amy mentioned, I do have the additional training through the Benson Henry the Center for Mind Body Medicine at Mass General. And that's based on the work of the cardiologist, Dr. Herb Benson, and his description of the relaxation response. And I give you the quickest overview of, but as a cardiologist, he was studying meditators and that they were able to lower their blood pressure and the heart rate. And what he really found was that there are multiple ways to break the train of everyday thought, and meditation is one of them. And I'm just going to love this slide. And on the number one, like these categories are all tools for stress reduction or strategies for stress reduction. And this is a great picture, and I like the person that's sitting cross-legged, but you don't have to sit cross-legged to elicit the relaxation response or to calm that stress response and engage the relaxation response. You can do it something through that deep breathing, the belly breathing, that diaphragmatic breathing I talked about, and you can do it through other things like relaxation response exercises, and it's an opportunity to break the train of everyday thought. So you can do it through prayer, through breathing techniques, even mindful movement, can be employed. There are a couple of things mentioned here, yoga and Tai Chi. Those are movement paired with breath, and that can elicit the relaxation response and break the train of everyday thought, which again, as I pointed out, that when we're stressed is often negative automatic thoughts that are adding to our distress. So we're going to talk more, and Ugne's going to talk more about movement, but I just wanted to, and we're going to talk about nourishment in terms of our nutrition and connection with others. But I wanted to kind of call your attention to the number 4, the category on the right, because these are other ways to break the train of everyday thought. We have the ability to attend to things in our environment that are positive or that we appreciate or we feel grateful for. And they don't always have to be huge, profound gratitudes, but they could be small appreciations, like a nice cup of coffee. So the other thing I'll point out is that other ways to break the train of everyday thought can be time in nature. There's a lot of growing research. Some people want nature to be the 7th pillar of lifestyle medicine, which I think would be nice, because time in nature does break the train of everyday thought and allows us to be mindful, which is another, mindfulness is another practice, a mind-body practice that can break the train of everyday thought and elicit the relaxation response. And humor is a great way to physiologically and laugh and engage your body in a healthy way that accesses and lowers your stress levels. So I'm going to just switch gears totally now to healthy eating or healthful eating, because as we know, when we are stressed or distressed, eating's one of the things, like with sleep, that's the first thing to go. So rather than call too much attention to the eating, I do want to call attention to this American Institute for Cancer Research, and this, you can have access to the slides. But I will say that all of these strategies for healthful eating that are approved and recommended for cancer prevention also help us in terms of managing our mental health and managing distress, because eating a diet rich in whole grains, vegetables, and fruits is really an anti-inflammatory diet, which helps promote our mental health and lower anxiety levels and depression. And there's been study after study that show that. So the changes you make to your diet, not just will benefit you in terms of cancer prevention or cancer risk, but also in terms of your mental health risk. And I love this picture because this again is a spectrum. We all live along a spectrum. There's this on the right-hand side, there's the whole food, plant-based or plant predominant eating pattern, which is perhaps, the gold standard of eating patterns these days. But we might sit more on the left-hand side, because a lot of the standard American diet, often referred to as SAD, does lack a lot of the fruits and vegetables and fiber that are so helpful. But any change, positive change, or sort of movement along that continuum towards, adding in more vegetables, even just adding 1 vegetable extra a day or 2, is really a positive, impactful change, and it's giving you the power to make these changes. So trying not to feel bad or beat yourself up about, maybe if your plate looks like this, and try not to think of it as like taking away things in your diet and limiting your diet, but really shifting the way and perspective you're taking is that you're adding in these healthful foods and maybe crowding out some of the other foods. Thinking of it that way can be often very helpful. And that's another helpful way in which to think about risky substances. And we're only going to really touch upon the kind of the two like most talked about substances, and because there are a lot of other risky substances too. But I think a lot of times people think of self-care, going out, having a drink. It's so complicated because alcohol does allow the opportunity for a lot of social interactions, which we're going to talk about is so good for us. But thinking about the way in which we engage in these or with these substances can be really helpful. Because unfortunately, alcohol it doesn't really offer us much, I'll have to say. And I know that this may be a somewhat unpopular topic because, again, there are things like getting together with friends or family members where there is alcohol might be, a prominent part of that. But unfortunately, high levels or higher levels, or really any level of alcohol, really does promote inflammation and can increase risk of cancer, several types of cancers, and it really doesn't help in any way. So again, I don't want to you've probably heard all of this before, so I don't want to spend too much time with this, but just to talk with you about how alcohol also impacts mental health and distress and anxiety, because many people feel like it's helpful to take the edge off or maybe to promote sleep, but it often actually does the opposite. It can make people feel more anxious, and it actually does disturb sleep. There's plenty of studies that show that. So trying to limit alcohol intake and swapping out, again, not maybe totally, but having sparkling water or making these drinks that are lower in alcohol content or non-alcoholic drinks are really can be very beneficial. And then the other sort of big risky substance to talk about is cigarette smoking has been shown to have a lot of risk associated certainly with cancer and other adverse health outcomes affecting mortality. But it impacts our mental health as well. So if we were to minimize and lower our smoking, we improve our anxiety and we improve our depression. So again, a lot of people are smoking maybe to kind of take the edge off, or that's one of the reasons why, people tell me a lot that they smoke. But if they're able to lower the smoking or limit the tobacco, it actually ultimately shows an improvement in anxiety and distress. And that goes for vaping as well and other substances. So I want to be mindful and pass this over to Ugne, and she's going to take over for the remainder, and I'll come back on in a little while. But thanks so much, everyone, for your attention. And Ugne, I'll be here and follow your lead in terms of advancing the slides.
Thank you very much for this, setting the stage for us. So let's talk about movement. Okay, let's just go ahead to the next slide. So it is well established that physical activity can reduce all-cause mortality, that it has a plentiful positive effects on our bodies and our physical bodies as well as our mental state. So we know it can boost mood and reduce anxiety and depression. It's a great opportunity for social connections, like taking a class or taking a walk together with a friend. We know that it can improve quality of life, and probably many of that is connected with the social connection piece. It can improve our sleep. So so frequently, that is the first thing that I recommend to my patients when we're working on improving sleep, is making sure we get movement in our day-to-day life. And we know that it supports our skeletal health, and as we age, our muscle mass declines. Our ability for deep breathing declines, and that if when those things are affected by various diseases, think that the decline can be even more rapid. So a way to push that off is engage in physical activity. We know it supports healthy immune system and supports healthy weight. In the cancer setting, it is the number one medicine that we recommend for cancer-related fatigue is increasing movement to best of one's ability. It can also improve appetite and decrease the chance of cancer recurrence. Let's go to the next slide. So, how does it, in terms of exercise and anxiety, it activates your brain. So it activates your frontal cortex of the brain. And just like Rachel, April was telling us about the stress response, so much of that is rooted in our amygdala. And exercise has a way to calm that amygdala down and say, it's okay. We can handle this. We can do it. So you have an expanded ability to manage stress. It also releases multiple neurotransmitters. There's a whole chemical soup that happens in our brain when we exercise: dopamine, serotonin, uh, uh, GABA, multiple chemicals get released in helping us balance and helping us with anxiety and stress. All, in many ways, exercise is a form of stress, but it's a form of stress that we engage in willingly in a controlled environment, and that we set the stage for our body that say, okay, I am going to put you under a period of stress right now, and I need you to do these things for me. I need you to walk. I need you to take these deep breaths. And as we put ourselves in these stressful, controlled stress environments, situations, it builds our ability to be more resilient when the unpredicted stressors come our way. In our bodies, it can reduce muscle tension, so and change up the muscle patterns, right? Yes, with exercise we get more muscle tension with the movement. However, the movement pattern of the exercise induced muscle tension and movement pattern of when we're stressed is very different. So I would like to invite you to join me in a very simple exercise that we can do right here in our seat. And actually, thank you, April. Let's go ahead to the next slide, and then we will get to exercise in just a minute. Let's just talk a little bit about how to introduce exercise in our lives, and then we'll do an exercise together. So, avoiding an activity, right? If you can move every hour, if the best of your ability, right? If you can get up and walk every hour, if you can stretch every hour, engaging in some kind of physical activity once every hour, that can include less strenuous or more strenuous activity, up to you. And remember that you can build up the strength and resilience over time. So if we only exercise 10 minutes a day, by the end of the week, we have exercise for 70 minutes, and that's a positive impact. What major organizations as Cancer for Disease Control and others do recommend that we should be aiming for 150 to 300 minutes of moderate exercise a week and resistance or strength training the 2 days a week. When we say moderate exercise, what does that mean? It's going to be different for every person. So, for instance, if you can walk or move and talk and sing, you are in a relaxed state. If you can walk, brisk, or engage in physical activity, and you can still talk, but you cannot sing, it means you have hit the moderate activity range. If you're in engaging in physical activity and you can talk and you can sing, you know that you are in a vigorous activity range. So that might be you're pushing yourself much, much harder. So finding that sweet spot and humming a happy birthday as you engage in physical activity to find what is that moderate range for you and where you can engage in that exercise and push yourself a little bit. So here we can so let's try do a little bit of movement activity together. So like I said earlier, our body when we're under stress moves very differently, right? So when we see the tiger, by design, our vision narrows. We all the only thing we can see and the only thing we should be seeing is like, okay, I saw the tiger, where is the way out? I need to get out of here. And our vision gets really narrow. Our muscles tighten. So same as looking at a lion or tiger, same as you needing to go get restaging scans or going to see your doctor or going in for treatment. The stress and anxiety can sort of tighten our shoulders, tighten our neck, our but we similar like attacking offending attack from a lion. We want to protect our vital organs so our body is safe. To break up that response, we can break it up by changing our movement. So if we just sit tall and instead of looking just straight at a screen as you are right now, see if you can expand your vision into periphery and see if you can and you can just bring your hands on each side of your head and see if you can catch the glimpse in your periphery of your hands moving outside the periphery. And you might notice right away that how internally there's a little bit of softening that happens because we moved from this stress state. We tricked our brain into relaxation by expanding our vision. The other thing that we can do to trick our brain into relaxation is by moving our neck. Because when your body is stressed, it does not think about rotating neck and opening up the vital organs. So opening your arms out and stretching out, right? And softening the neck and finding some movement in your body. And as you do that, it engages the relaxation response. Physically, your body lets your brain know that you're okay. Let's go to the next slide. Let's talk about sleep, okay? So we know that sleep problems in the long-term cancer survivors often are related to fear of cancer recurrence. And nearly 40% of cancer survivors have sleep problems as far as 5 years after diagnosis. So we know it's an important topic to address and an important area for us to focus on. And 10 to 27% of cancer survivors have a higher incidence of sleep disturbance. So when we have poor sleep, it amplifies the activity in the brain, in that amygdala, in that survivor fear and survival center in the brain, and makes it more reactive to stress, right? Um, it can worsen our mood vulnerability. So we might get a little bit more jumpy, so to speak, more reactive. And it also affects those neurotransmitters that we talked about when addressing physical activity, that it affects how these neurotransmitters are transmitted out in our brain, and the same ones affect sleep and emotional regulation as well. Let's go to the next slide. So what can we do about it? Some of the very, very boring things, like having a regular sleep schedule. S- s- Something I want to highlight, if you have experience of being around small children or raising children, you can tell really quickly if they're not getting enough sleep. They get cranky, have meltdowns, and physiologically, we still do as well. If we don't get sleep, our bodies get affected just the same. So having a regular sleep schedule is still so, so, so important. So having consistent time you're going to bed and consistent time that you're waking up. Minimizing light exposures. We are affected by circadian rhythms, which means that our bodies are connected with the outside world, and we must rise with the sun and go down when the sun goes down. So, having light exposure in our bedroom makes it harder for our brains to come down. If there's artificial light, television, blue screen on, on our cell phones, those send signals to our brain that it's daytime and we should not be sleeping. So, for better sleep, minimizing the bedroom lights, minimizing the bedroom noises can be really helpful. Physical mobility, right? Moving at least every hour during the day, and increasing the sunlight exposure. A best time for the sunlight exposure can be at sunrise and sunset. So getting outside when you would get up in the morning, and having a little bit of outside time before bed. Also, staying hydrated through the day can be really helpful for improving your sleep. Next slide. Let's talk a little bit about relationships. I want to make sure we leave time for questions, but essentially just like physical activity. So social connections have multiple benefits for our health and well-being. It enhances our ability to cope with stress. From research, we know that people who have strong social connections, strong social circles, can see themselves and be as being able to cope with stress better. So it expands our ability to handle stress, and also creates a little bit of buffer between us and the stressful situations. 50% greater survivorship. So this is relates to general population, but that's significant, and we're seeing these trends in the cancer survivors as well. Also, mental health. It's improves our resilience, and it's a source of positive experiences. Go next slide. The way social connections are relevant in cancer care is we know that majority of these studies are done in the breast cancer survivors. It's a big bulk of cancer literature comes from studying breast cancer survivors, and we know that from those studies that p- folks who have a stronger, wider social networks will report improves quality of life. And they will also note that their symptoms of depression and anxiety and fear are much better when they have social connections, good, strong social circles. And we're seeing emerging data as well that perceived social networks. So it's really not as much about the size of your network, but how you perceive it, that perception, just in a positive sense, lion or a tiger, or I'm sorry, lion versus cat perception. That if you have a perception that you have good network of support around you, that is so meaningful. Next slide. So something that we do frequently in lifestyle medicine, we utilize these SMART goals where we create a specific, measurable, attainable, and realistic goals for ourselves. So, for instance, to make one could make a SMART goal for strengthening social connections. So, to make a specific goal, I could say, I want to feel connected to my friends. So, that's specific in the sense that, okay, I know it's the friend group, right? But we want it to be even maybe even more specific. I could say I want to connect with 3 friends to make it measurable. So I could say, okay, I'm going to make 3 phone calls by the end of this week to connect with the friends I haven't spoken to in a long time. It has to be attainable. I have a very busy week. I don't know if I can pull it off. Maybe let's just stick with 1 friend. I'll make a 1 phone call this week to connect with a friend. So that makes it realistic so that I can be honest and sincere with my own situation and see can I actually achieve it. And time, so having a, a timeline to commit to it. So I said, okay, I'm gonna do it this week. So I'm gonna pass this on to April and to lead us into creating some SMART goals for ourselves.
Thank you so much. And actually, I just wanted to, since I was listening to you lead that, I was in a lecture. Some of you might have heard this one by Dr. Waldinger. So he gave this talk, I can't even remember where, but during the talk, he was like, while sitting here, text one person you know, either a friend or family member, and text them right now, and then see if they get back to you. Because to your point, it is important to reach out, and sometimes we think we don't have the time. So it was so neat that he did that. So by all means, if anybody wants to text a friend right now and set up an appointment for later to talk on the phone, then that's a great idea. But thank you for mentioning that, those SMART goals, because we want to just leave this up for another minute, and because we do want to answer questions. But I'm going to just invite you, just like Ugne said and did and demonstrated, that these SMART goals don't take that long to make. She kind of narrowed it down to specific pretty quick, right? So I will invite you, and we'll just leave you just a little bit of time to make a SMART goal. It could have been around something we talked about. We talked about these 6 pillars, the stress, reducing stress, enhancing, your diet, or enhancing your physical activity or your sleep. So you might want to make a specific goal around that. Could be getting to bed by 10 p.m. It could be that specific, but if it's measurable, that's a time. So that is measurable and attainable. That's not maybe realistic to do, 7 nights a week by 10, but it might be 2 nights a week. So just think about that for a moment for yourselves and just jot down SMART. So we don't have a lot of time, but SMART somewhere. And you can come back to making that goal for yourself. But this is basically how you do it. And I wanted to just bring up these resources, and Ugne made this awesome QR code on a door of the Mass General. So it's so cool and it actually works. Not that I didn't think it would, Ugne, but it does. So if you wanted to, you can put your camera over that. If you have one of those types of cameras, and it can open up to the support page, because, sometimes we do have supports in our life, our own, network, as you point out. We have some core people, but sometimes we need institutions or other people to help fill in those supports. And we have a lot of supports at Mass General, and those are all listed at on the right-hand side. And some of them we mentioned here today. And then there's a lot of local community programs, that are listed, like the Livestrong program at the Y, the Healing Garden. I won't go through them all, but there are a lot of great ones. The other one I felt would be remiss if we didn't mention it, because we did talk about mental health conditions, and just wanted to again be mindful that May is Mental Health Awareness Month. There is a mass helpline, even though I already said that there's a lot of psychology and social work and psychiatric help at the Cancer Center. There are also these lines if you happen to not be at the MGH program. There's ones in Massachusetts, and many of you hopefully all know that there's the relatively new National Suicide and Crisis Lifeline, which is 988, and that's a really great program that's staffed 24 hours a day. So I think that was our last slide. Again, we don't have much time for questions, but maybe a couple. And I'll see if Amy sees any.
Wow, thank you for that really amazing overview. And I was just grateful to be on this Zoom with both of you for a social connection for the day, because you guys are such great colleagues. Anyway, I'm going to look in the chat to see if there's some questions. And for those of you with us, please feel free to put some in the chat or in the Q&A box. There is an interesting question. I'll start with Ugne. Our participant was like, found your exercise and movement recommendations so interesting, and commented that there was a recent article in the New York Times that was like referencing the debate about when is the best time to exercise, like the morning, the afternoon, the evening. And she wanted to your thoughts regarding that.
Thank you so much for this question. So I think the most important thing about exercise is to exercise. That's the most important thing. And if we have ability to choose when to exercise, when to engage that activity, for some of it also depends on what is the purpose of the exercise. What are we trying to achieve? Is our exercise, we're targeting because we want to do exercise because we want to build strength in our muscles, build strength in our cardiovascular system, or we're engaging exercise and activity because we want to engage more of a relaxation response. So if we can be more clear with ourselves, with just asking ourselves a question, what am I trying to achieve? What is my goal? In terms of physiological and balancing responses to our body, we know that when we wake up, our body produces stress hormone called cortisol, and cortisol goes up with the sunrise and goes down with the course of the day. So it can support a healthy stress response if we engage in physical activity in the morning, and then allow the stress response to go down and do more relaxing activities towards the end of the day. But again, it really depends on the individual and what is the purpose that you're trying to achieve. I hope that answers it.
I think that's a great answer. April, did you want to comment further?
No, I was just going to say the other thing that I think people forget is that some people work different shifts, and it's hard to know what's right for the right person. So I think you've answered it perfectly, because it's whenever you can, frankly.
Wonderful. I'm sure there are many other questions, but it is 12:59, so I'm just being mindful of everyone's time. I will say thank you. These slides and this wonderful talk will be available on YouTube and for further reference, and we will send out a follow-up email with some resources for further information. So thank you so much to our amazing speakers.
Thank you so much. Bye, everyone. Thank you.